Picture yourself in this exact scenario. The moment arrives, that intimate peak you've experienced countless times throughout your life. Your pulse quickens, your breathing deepens. Every sensation washes over you just as it always has. The release comes, powerful and complete. But then, in the stillness that follows, you glance down and discover something unexpected. Nothing is there, not even a trace. The climax was real, the pleasure undeniable, but the physical evidence has vanished entirely. Suddenly, your mind floods with urgent questions. What's happening to my body? Have I lost something fundamental? Is this permanent? This experience creates a deeply private crisis that millions of men face, yet almost nobody discusses openly. Here's the reality. This happens to a significant number of men past 60, yet the topic remains locked behind closed doors. We'll freely discuss our cholesterol numbers, our aching knees, our blood sugar levels. But when it comes to what's happening in the bedroom, silence takes over. Men carry these concerns alone, wrestling with fears they can't voice. That isolation ends today. What you're experiencing has a medical name: dry ejaculation. And here's what you need to understand immediately. This condition doesn't mean your desire has disappeared. It doesn't signal the end of your sexual life. It's not proof that you've lost your masculine identity. What it actually represents is your body communicating a change, sending you a clear signal that something has shifted physiologically. And here's the most important truth. In the overwhelming majority of cases, dry ejaculation has a specific medical cause, and more often than not, it has an effective treatment. Over the next several minutes, we're going to walk through this together with complete honesty and medical clarity. You'll understand exactly how ejaculation functions in your body, learn what changes occur after 60 that affect this process, and discover the specific reasons why semen production might decrease or stop entirely. Men sit in medical offices every week, struggling to find the words, their voices barely above a whisper. Some admit they've been avoiding all physical intimacy for months, living in constant fear that their partner will notice and ask questions they can't answer. Others confess they've created elaborate excuses, entire stories about being tired, stressed, or unwell, anything to sidestep intimate moments that now feel loaded with potential humiliation. But here's what we need to address. The emotional weight of the silence often causes more damage than the physical symptom itself. This strikes at the core of how men define themselves, their identity, their sense of completeness as a man. For decades, from adolescence onward, the visible presence of semen has represented virility, potency, sexual capability. When it suddenly vanishes, many men experience it as losing a piece of their fundamental identity. The question haunts them. Am I still a complete man? That question creates a ripple effect of insecurity that extends far beyond the bedroom. What makes this particularly destructive is the psychological cycle it triggers. It starts with confusion and concern. Then that concern transforms into persistent anxiety. You begin analyzing every potential intimate situation, wondering if it will happen again, if this time your partner will notice. This performance anxiety becomes its own problem, creating emotional distance. The fear of judgment drives men to withdraw completely. They pull back emotionally first, then physically, creating a gap in the relationship that wasn't there before. But here's the critical truth. That silence solves absolutely nothing. It makes everything exponentially worse. Walls go up where openness once existed. Anxiety breeds avoidance. Avoidance creates distance. Distance deepens into isolation. What actually destroys a man's confidence isn't the absence of fluid, it's the suffocating silence around it. The constant worry, the mounting frustration, the quiet sadness, these are the real consequences. That's precisely why understanding what's actually happening becomes so crucial. A dry orgasm doesn't mean your sexual desire has evaporated. It doesn't mean you've lost the capacity to experience pleasure or provide pleasure to your partner. This isn't a final judgment on your masculinity. It's a physical signal from your body, nothing more, nothing less. A signal that deserves investigation and understanding, not shame and secrecy. your value as a man, your virility, the essence of who you are, none of that can be measured by drops of fluid. Never could be, never will be. Once you grasp what's actually occurring inside your body from a medical standpoint, you can reclaim your confidence, restore your peace of mind, and reconnect with intimate well-being. To truly understand dry ejaculation, we need to clear up a fundamental misconception. Most people believe orgasm and ejaculation are the same thing, a single, unified event. But medically, physiologically, they're entirely separate events, controlled by different systems, capable of happening independently. The orgasm is neurological. It happens in your brain and nervous system. It's that intense wave of pleasure, that peak moment of climax. Think of it as a cascade of electrical signals firing through your nervous system, creating waves of pleasure, triggering muscle contractions. This is precisely why you can experience a complete, fully satisfying orgasm even when no semen appears. The pleasure component remains totally intact. Ejaculation is mechanical, a physical process involving glands, ducts, and muscles working in precise coordination. To visualize this clearly, imagine ejaculation as an orchestra performing a complex piece. The testicles produce sperm cells. The seminal vesicles produce the bulk of seminal fluid, over 60% of total volume. The prostate gland contributes a milky fluid that protects sperm cells. Finally, the pelvic floor muscles contract in powerful rhythmic waves, propelling everything forward through the urethra. When everything functions properly, your brain acts as conductor, signaling the performance to begin. The orgasm is the beautiful music you feel. The ejaculation is the physical sound the orchestra produces. Normally, these synchronize perfectly. So what happens during a dry orgasm? The conductor gives the signal. The melody plays beautifully. You feel every bit of pleasure. But one or more instruments in the physical orchestra has gone silent or is malfunctioning. The music is absolutely there. But the physical output, the visible semen, is missing or dramatically reduced. This leads to the critical question: which instruments fall silent, and why does this happen, particularly as we age past 60? The most common cause by far is retrograde ejaculation. The term retrograde simply means backward movement. During climax, instead of traveling forward out through the urethra, semen travels backward into your bladder. At the base of your bladder, where it connects to the urethra, there's a small muscular valve that's supposed to slam shut at the exact moment of ejaculation. This forces semen to take the only available path, forward and out. In retrograde ejaculation, that valve doesn't close properly. When your pelvic muscles contract to expel semen, the fluid takes the path of least resistance, backward into the bladder. You still feel the orgasm completely because the muscular contractions still happen, but the fluid goes the wrong direction. While this sounds alarming, retrograde ejaculation itself causes no physical harm. The semen simply mixes with urine in your bladder and exits your body the next time you urinate. Many men notice their urine looks cloudy or milky after a dry orgasm. What causes this valve to malfunction? The most frequent culprit is previous prostate surgery, particularly TURP. This common surgery treats enlarged prostate but can sometimes damage the nerves, controlling the bladder neck valve. Certain medications also cause this problem. Alpha blockers, commonly prescribed for high blood pressure and urinary symptoms, work by relaxing smooth muscle. Brand names include Flomax, Cardura, and Uroxetrol. These medications can relax the bladder neck muscle too much, preventing proper closure during ejaculation. Chronic medical conditions, particularly poorly controlled diabetes, cause progressive nerve damage over years. When this diabetic neuropathy affects the specific nerves that signal the bladder valve to close, retrograde ejaculation results. The second major cause is physical blockage somewhere in your reproductive system. Unlike retrograde ejaculation, where semen goes backward, blockage means semen can't reach the urethra in the first place. The seminal vesicles produce over 60% of seminal fluid volume. If the tiny ducts carrying this fluid become obstructed, total semen volume drops dramatically, sometimes to nothing. What creates these blockages? Most commonly, scarring from past infections that occurred years earlier. Chronic prostatitis creates internal scar tissue. Sexually transmitted infections, particularly chlamydia and gonorrhea, if not promptly treated, leave permanent scarring in reproductive ducts. Previous pelvic surgeries can inadvertently create scar tissue blocking these delicate pathways. In rarer cases, small stones form inside seminal ducts or the prostate itself. Some men develop fluid-filled cysts near the seminal vesicles that grow over time and compress the normal pathways. The third significant cause involves hormones, specifically testosterone. Think of testosterone as your orchestra's conductor, ensuring all instruments are tuned and ready to perform. Testosterone regulates sperm production, influences prostate and seminal vesicle function, maintains sexual desire, and supports overall reproductive tissue health. As men age past 50, and especially past 60, testosterone levels naturally decline. This age-related testosterone drop is essentially the male equivalent of menopause, though it occurs much more slowly. When testosterone falls significantly, seminal fluid production decreases. The seminal vesicles and prostate produce much less fluid. Total semen volume drops progressively. In some men, particularly those with very low testosterone, this reduction becomes so significant that ejaculation appears dry or nearly dry. This often accompanies other recognizable low testosterone symptoms: persistent fatigue, noticeable loss of muscle mass, increased body fat, especially around the abdomen, reduced sexual desire, difficulty achieving erections, mood changes, concentration problems, and reduced drive. Additionally, chronic diseases like poorly controlled diabetes and chronic high blood pressure progressively damage small nerves and blood vessels throughout your entire reproductive system. This cumulative damage impairs the function of semen-producing glands and the muscles that expel it. While dry ejaculation is frequently benign and often linked to normal aging or necessary medical procedures, it can sometimes signal something more serious developing. Knowing when to seek immediate medical attention is crucial. Here are the specific red flags demanding immediate medical evaluation. First, sudden unexplained onset. If you've ejaculated normally your entire adult life and then overnight experience completely dry orgasm without obvious reason, that abrupt change needs investigation. Second, pain or significant discomfort. Sexual pleasure and climax should never hurt. If dry orgasms come with discomfort, unusual pressure, sharp pain, or burning during climax, that's abnormal and shouldn't be ignored. Third, and requiring truly immediate attention, blood. If you notice blood in your urine anytime, or ever see blood-tinged semen even once, that's a significant red flag demanding immediate evaluation. This can indicate issues ranging from relatively simple infections to more serious conditions including prostate cancer, bladder cancer, or kidney stones. Never ignore this symptom. Another serious warning is dry ejaculation appearing alongside new neurological symptoms. Pay extremely close attention if you notice progressive leg weakness, loss of sensation in your genital area, or new sudden problems controlling urination. These symptoms together could indicate significant neurological condition or spinal cord problem. And finally, if you experience persistent fever, chills, body aches, or prolonged feeling of being generally unwell, along with dry ejaculation onset, your body may be fighting active infection. Untreated reproductive system infections lead to serious complications. If you've experienced any of these specific warning signs, don't hesitate even one day. Schedule an appointment with your primary doctor or urologist immediately. After acknowledging the issue, the next step is exploring solutions. Modern medicine offers comprehensive, effective strategies for accurately diagnosing and successfully managing dry ejaculation. The first and most critical step is obtaining accurate diagnosis. A urologist typically starts with simple, non-invasive tests to pinpoint the underlying cause precisely. The post-orgasm urine test is the most straightforward way to confirm or rule out retrograde ejaculation. You empty your bladder, achieve orgasm, then immediately urinate into a sterile cup. The lab examines urine under microscope, looking for sperm cells. If significant sperm numbers are found, that's clear confirmation that semen is being redirected backward into the bladder. Another valuable diagnostic tool is transrectal ultrasound. This imaging allows doctors to visualize the prostate and seminal vesicles in remarkable detail, revealing potential physical obstructions like cysts, stones, scar tissue, or blockages. Finally, comprehensive hormone panel blood testing is essential. This measures testosterone levels along with other key hormones. Low testosterone is extremely common in men experiencing dry ejaculation, and it's also one of the most treatable causes. Once your dry ejaculation's specific cause is clearly identified, treatment approaches can be precisely tailored to your unique situation. If retrograde ejaculation is confirmed and caused by medication, particularly alpha blockers, your doctor may be able to adjust your prescription. Sometimes dosage can be reduced, or you can switch to alternative medications without the same sexual side effects. If retrograde ejaculation is caused by weak bladder neck muscle, certain medications can be prescribed to strengthen that muscle. Drugs like pseudoephedrine, imipramine, or brompheniramine can help tighten bladder neck muscle and encourage more complete closure during ejaculation. If diagnostic imaging reveals physical obstruction, the solution might require minor surgical procedure. Modern endoscopic surgery techniques allow skilled urologists to use tiny cameras and specialized instruments inserted through the urethra to visualize and clear blockages without external incisions. In cases where the cause is hormonal, specifically low testosterone, testosterone replacement therapy can be absolutely life-changing. This therapy restores testosterone levels to normal, healthy ranges. Testosterone replacement can be administered as topical gel, adhesive patches, injections, or small pellets implanted under skin. Testosterone replacement therapy does much more than potentially improve ejaculate volume. It can significantly boost overall energy levels, restore sexual desire, improve erection quality, help build muscle mass, reduce abdominal body fat, improve mood, sharpen mental focus, and enhance overall quality of life. However, TRT must always be done under strict, ongoing medical supervision with regular blood testing. The third category of solutions lies in optimizing daily habits and overall health. Your intimate and reproductive health directly connects to your overall physical health and lifestyle. First and most important, if you have chronic conditions like diabetes or hypertension, keeping them under excellent control is absolutely vital. Managing blood sugar and keeping blood pressure in normal range actively protects delicate nerves and blood vessels, essential for normal ejaculation and overall sexual function. Second, regular physical exercise, particularly exercises strengthening pelvic floor muscles, can significantly improve ejaculatory control. Kegel exercises, where you repeatedly contract and relax these muscles, can be performed by men just as women do them. Contract these muscles, hold 5 seconds, then relax 5 seconds. Repeat 10 to 15 times, multiple times daily. A well-balanced, nutritious diet plays enormous roles in maintaining sexual health. Diets rich in colorful fruits and vegetables, fatty fish, nuts and seeds, whole grains, and healthy fats have been shown in numerous studies to protect the prostate, improve hormonal balance, reduce inflammation, and support healthy sexual function. Additionally, adequate, high-quality sleep is crucial but underestimated for sexual health. During deep sleep, your body produces and regulates hormones including testosterone. Chronic sleep deprivation suppresses testosterone production and contributes to fatigue, low libido, and poor sexual function. Finally, and perhaps most importantly, we cannot forget the emotional solution. the single most powerful tool you have is open, honest communication. Talking openly with your partner about what's happening can feel uncomfortable initially, but in vast majority of cases, it brings profound relief, strengthens relationships, and opens doors to mutual support. When partners understand the medical reasons behind changes you're experiencing, fear and insecurity are almost always replaced with empathy and genuine desire to support you. Your partner likely already senses something is wrong, and absent information, they may be creating their own fearful explanations. By sharing the truth about what you're experiencing medically, you replace painful misunderstandings with facts and reassurance. You are absolutely not alone in this experience. More and more men in their 60s, 70s, and beyond are consulting healthcare specialists about dry ejaculation. Every conversation with healthcare providers opens doors to information, solutions, and better quality of life. Remember this fundamental truth. Silence doesn't heal anything. Communication does. Let me close with a clear, direct, and hopeful message. Dry ejaculation is not the end of your intimate life. It's not a final sentence on your sexuality. It doesn't mean your masculinity or your value as a man has faded. It's simply a signal your body is sending, an important message needing to be heard, understood, and addressed with knowledge and appropriate medical care. Countless men over 60 have walked this exact path. They initially all shared the same painful emotions: fear, silence, confusion, shame. But they've also rediscovered their confidence, their joy, their peace of mind, and their satisfying intimate connections once they understood what was truly happening in their bodies and took steps to address it. Your body still responds to pleasure. Your capacity to feel desire remains alive inside you. Your ability to enjoy deep, satisfying intimacy has absolutely no expiration date. That's why we invite you today to take one courageous step forward. If this message has resonated with you, break the silence. Talk honestly with your partner. Schedule an appointment with your doctor or urologist to get proper evaluation. Take action rather than remaining trapped in fear and isolation. Your intimate life can continue to be deeply satisfying well into your 60s, 70s, 80s, and beyond. If you found this information valuable, subscribe to Men's Health 365 and click the notification bell. We create new videos every week covering critical health topics specifically for men over 60. Drop a comment below telling us which country you're watching from. We read every comment, and your feedback helps us create content addressing the issues that matter most to you. Thank you for trusting us with this sensitive topic, and we'll see you in the next video.